Okay, welcome to another episode of Dr. Yass Live on YouTube. This episode, we are going to focus on what's out there on the internet, specifically Facebook, that is being promoted as the magical answer to resolving people's pain. It's amazing how if you went on Facebook on the news feed, you would see the vast majority of what us is the coronavirus, things about it, for it, against it, all this stuff going on. And yet, with the country and the world focused on the coronavirus, there still seems to be that magical attempt to promote something that will resolve the world's pain. And if anything, I think that it reinforces just how significant the issue of pain truly is. If you think about it in terms of health related issues in the United States, the cost of treating cardiovascular disease, which is the home run ball usually of health related issues, costs about $400 billion, whereas the cost of treating chronic pain in the United States is close to $750 billion, almost double what's being spent on coronary disease, cardiovascular disease. So you can clearly see that in terms of just the financial issue, the number one issue that addresses people is pain. And so the reality is that the medical system has failed miserably. There's no question about that. In 2002, the number of people, or 2008, when I wrote my first book, the number of people suffering from chronic pain was about 70 billion. I think it was 70. Oh, the cost of treating chronic pain, I'm sorry, was 70 billion. And then by 2011, it went up to 635 billion. So in 9 years, the cost went up from 70 billion to 635 billion. I think that at the time that I wrote that book in 2008, there was 75 million people suffering from chronic pain. And by 2011, it went up to 130 million, 75 million to 130 million, almost doubling in that 9-year span. And I don't see any evidence at this point that the numbers are diminishing at all. And the primary reason is what I put right here. From now on, every time I do a YouTube video, this is going to be the backdrop, because this is the lesson learned. Misdiagnosis equals chronic pain. I will forever state that mantra as to the reason that chronic pain exists globally. Globally, it is because the medical establishment globally continues to promote the idea that diagnosing through diagnostic tests like MRIs and X-rays, finding structural variations, is the answer to establishing what tissue is in distress, causing people's pain. This is baseless. Baseless. It is based on the premise of correlative theory, which everybody, any scientist, knows is considered junk science. It is the equivalent of saying, if I open my front door when the sun rises, I can say opening my front door causes the sun to rise. Insanity, right? If I have a herniated disc identified for the first time when I have pain, the herniated disc must be causing the pain. Well, lots of things can be found while you're having pain. You have 2 elbows. So why isn't 2 elbows the cause of the pain? The only reason that you're willing to accept the idea that a herniated disc or arthritis may be causing the pain isn't a medical preposition. It's cultural. It has been said to you so much by so many people that you simply accept it as truth, when there is actually no medical presentation. We look at herniated disc, for instance. The stupidest part of the disc one that I think is the most insane is the fact that disc material is made of fibrocartilage. Just like the labrum in the hip and the shoulder, just like the meniscus in the knee, fibrocartilage has no pain receptors. So it actually is impossible that a disc be able to create pain. That's just fact. That's just fact. And yet the medical establishment shows you the picture, says there's a herniated disc, and says, okay, since it was identified at the time you're having pain, it must be the cause. What about the fact that as many people with no pain, absolutely no back pain, have been found to have the same structural variations in the same percentages as those with pain? That's actually showing that the structural variations are independent variables to pain. That's what that means from a scientific study basis. The way it should work is that, let's say that we're saying herniated disc cause pain. The null hypothesis, or the opposite hypothesis, is that people without pain should not have herniated discs. That's how it works. So you have to do a study and show all these people who have pain have herniated discs, and all the people who don't have pain don't have herniated discs. And what does the study show? Just as many people in the no pain group have the same amount of, in the same percentages of the herniated discs and the structural variations as those people in the pain group. If you need more evidence, I can be happy to present you with all the freaking studies at this point that have shown this. There are major medical organizations acknowledging that because these structural variations are identified in the same percentages in those without pain as with pain, that they now recognize them to not be associated with pain and are simply parts of the aging process. It's not just me, it's massive medical organizations. And yet the medical system won't stop because the big money is in treating these structural variations as promoted to be the cause of your pain. Let me just briefly stop here for a second. I'm just going to put my email address in here for a second, just in case anybody does decide they want to get a copy of any of these studies. Okay. So there's my email address. I'll leave it up there if anybody wants to get anything. Or if you decide you want to contact me, maybe you're in pain and you've decided, hey, the medical system hasn't done it for me and I'm looking for a completely different alternative. There's the Yass method. That's what it's there for. Completely outside the medical system. The only person I am aware of globally promoting the abolishment, that's right, the abolishment of the MRI and X-ray as the primary mechanism to diagnose and treat pain, period. Period. You need to look at the clinical presentation of the body, the symptoms that the body's presenting to identify which tissue is in distress, eliciting those very symptoms. That's what the body does. That's the magic of how your body is actually your friend, right? So something isn't working. That particular tissue says, I got to let this person know I'm not working. I need some help. Boom, it elicits a symptom. You try to become aware of those symptoms, and then you try to act on those symptoms, hopefully going to the right professional, medical professional. But in the case of pain, there is no right medical professional because the entire system has put their money on the use of diagnostic tests. So regardless of who you go to, it's the MRI's finding that is going to be the guiding principle as to what treatment you get. So it's going to matter. And the funny thing is, depending on the specialty you go, they'll take that piece of the MRI finding, right? So if you go to a neurologist having some sort of back pain, trust me, they're going to tell you there's something wrong with your nerve. It's something, neuropathy, something like that. If you take that same MRI to the orthopedist, he's going to tell you it's the structure of the spine that needs the surgery. You take that MRI to the chiropractor, he's going to tell you need an adjustment. They're all going to tell you something different. Then there's that poor physical therapist who's just going to get you as a referred patient, and whatever the referral says, that's what they're going to treat you for. So they don't even attempt, and they're not required by law to confirm or refute a medical diagnosis. The podiatrist, boy, I'm going to be treating some lady tomorrow doing a Skype session. Boy, she got some major surgery to her foot. Since then, her ankle is horrible. She can't weight bear. She can't do anything since that foot surgery. She goes back to the podiatrist, whoever did that surgery, and boy, they wiped their hands clean of that lady. Oh, I don't know what it is. Maybe it's coming from your back. And the podiatrist or whoever did that surgery referred this poor lady now to a spine surgeon, trying to convince her that her ankle pain is from her back, a nerve impingement or a nerve root impingement. Ladies and gentlemen, let's wake up to reality. There's no such thing as a nerve or nerve root that innervates a joint. That's crazy stuff. That's really starting to get to the outer fringe of insanity. And yet, that's what they're trying to promote to this lady. And here's my favorite part. So instead of looking at it from a scientific point and thinking theoretically, can we identify something in the lumbar region that might incite pain in the ankle, and then trying to discuss it and see if her symptoms relate to that, their attitude is they want to do some sort of nerve block to her and see if it changes her symptoms. And if it does, oh my God, that must be the answer. We should do surgery. And if not, oh, we'll just try a different one. When they say trial by fire, they're not kidding. That's the way the medicals, this idea that if you want to determine whether something is causing something else, you actually do something, a treatment, first to determine whether the treatment's going to be effective. There is nobody in the scientific community that would ever justify this concept. This is insanity. Before you do anything, there has to at least be a theoretical basis for what's going on. That's why everyone is in chronic pain. Misdiagnosis. Misdiagnosis equals chronic pain. You will eventually be stating this mantra as much as I state it. It's only inevitable that you're going to come to this conclusion through your little path, through the medical world, through the medical system. You're going to find out that everything I'm saying is exactly right. You want to reach this, a pain-free life? You better recognize that the only answer is to get that right diagnosis. And the answer is not through diagnostic tests. Only through the interpretation of the presentation of symptoms can you identify what tissue is in distress, eliciting the very symptoms you are experiencing. The only diagnostic model outside of diagnostic tests is the Yass method. Let's be very clear. The Yass method is not just a treatment model. It is a diagnostic model. If I give you examples like somebody has ankle pain and they're being told that the cause of their pain is coming from some nerve root, you have to understand that you could never get the right diagnosis based on that. I can assure you they will search and search and search, but there is no such thing as any nerve or nerve root that innervates a joint. That is pure insanity. Another lady just called me. She believes she has some kind of pain in the hip or groin region. She went, got an MRI. They told her she found a labral tear. That must be the cause. She went to somebody else. It's not the labrum. Now it's some sort of muscle. She tries to go to different people to figure out what muscle it is because she's just going to people that don't have any diagnostic capacity. They'll just do lots of purposeless exercise, and she just continues to suffer. She can't sleep at night. It's the usual nonsense. That's all you hear. It's the same stuff over and over again. Why? Because nobody's getting the right diagnosis. They are being misdiagnosed. So what's left? 130 million Americans. 22 million of those Americans are addicted to prescription pain medication. Right? 1 billion people worldwide suffering from chronic pain. So now you got the coronavirus going on here, and suddenly they're talking about the rise in depression and suicide rates. The depression and suicide rates have been skyrocketing for 20 years since the pain epidemic developed in the 1990s. We're talking 30 years now. This has been going on. The number of people suffering from pain, as I've described, has gone up to 130 million, roughly 1 billion worldwide. 1 out of every 7 people in the world are suffering from chronic pain, right? What do you think is going to happen with that? Just spend some time. Many of you are in pain. You know what happens. It's not the pain that's leading to the hopelessness, the depression, and the suicidal thoughts. It's the belief that the pain will never end because you can't find anybody capable of identifying and treating its cause. That's what's leading to hopelessness, depression, and suicide. And suddenly now the answer is being cooped up in your house is the answer? The chronic pain situation is a hell of a lot worse and has a greater effect on people's lives. So what happens? People are depressed, hopeless, and they're looking for anything that might change the path of their life. Maybe bring them a little relief. Maybe give them a day where they could be normal, be able to get up in the morning, maybe go to work without pain, maybe have a civil conversation with a family member, maybe wake up and not want to cry that day. So what do you got out there? Charlatans, sharks, all out there promoting crap, pure, unadulterated crap. Same situation, no theoretical basis, no justification that this stuff works. But a person in pain with enough money in their pocket, they're going to try to buy it. And that's what they're out there. So I just decided to go on the newsfeed on Facebook. And boy, in about 15 minutes, this is everything I got in 15 minutes. So I'm just going to go through these. And I thought it'd be a lot of fun just so you can see how insane it is. And maybe some of you, some of the people that will watch this have seen these and have considered them. And if I can stop you from pissing your money away, God bless, then I've done something good and I provided some justice in the world and hopefully got you thinking more in the line of logic as to trying to stop in terms of addressing your symptoms and trying to recognize that without the right diagnosis and the right cause, you will end up in chronic pain for the rest of your life. Any of these things at best would minimize your symptom, but in most cases, it's actually going to enhance the cause. So we'll just go through a couple of these. I thought it'd be interesting. So the first one here, this is actually some sort of knee brace. And as you can see in the back of it, it's spring-loaded. So if you were to squat down, you're not going to have to use your muscles to assist you in standing up. The magical spring-loaded component is going to do that for you. Right? You see the springs up here? Right here. All spring-loaded. Right? So let me ask you this. You're having pain in your knee and somehow bending down, you get this thing to do the work for you to bend, to get you to come up. Is this going to enhance the strength of the muscles required for you to stand up or walk or climb stairs? Or is this going to replace those muscles? It's going to replace those muscles. When muscles get replaced, they don't work as much, and therefore do they strengthen or weaken? They weaken. So when using this over a long enough period of time, you will probably weaken your muscles to the point where you will never, ever be able to stand up. You will never be able to climb stairs or kneel to the ground and get up. And you will be so dependent on this that at one point, not even this will have enough force output to get you up. And that's it. You're done. You won't be able to function because one day you saw a commercial about some magical thing that was promoted as helping you resolve your knee pain, when in fact, it will do everything in its power to make you weaker and worsen your symptoms over time, to the point where my opinion is there'll be a point at which you won't be able to function anymore because you won't even have enough strength. Not even that brace will have enough force to push you through your functional activities. Very dangerous. Here we go. Now, most people know that if you go for physical therapy, that one of the components that they like to promote and provide is electric stimulation. Most people didn't understand why supposedly they're giving you electric stimulation when you have back pain. It has to do with something called the gate theory of pain, which says that there's a point in the brain where both sensory response, tingling, numbness, things like that, enter the brain at the same place where pain does. It's a gate. And the idea is that if you have enough sensory response, tingling, or that type of thing, then if that's greater than the amount of pain impulse coming in, you don't experience the pain. Ergo, electric stimulation as a way of minimizing pain. So here we have, it's not enough to be able to go to physical therapy. You need to have your own, an electric stimulator for the lower back. And even Shaq, with his Thermacare, is promoting the Thermacare patch with the electric stimulation. Let's say that it even worked for some short period of time. I'm not sure. Is the idea that you plan to wear that 24 hours a day, 7 days a week? What if you go in the shower? Probably get electrocuted, I would imagine, right? No pool. God forbid it rains, right? Those probably ideas aren't going to work so good. So how exactly is electric stimulation addressing the cause, the tissue in distress? It's not. It's simply addressing pain, which is an impulse. Pain is not an entity. Pain is not your kidney, your liver, or spleen. Pain is not a tissue. It's simply a sensory response that is emitted from a tissue. And the only way to stop the pain signal is to address the tissue in distress, eliciting the symptom. So unless you can tell me that any of these things I'm showing you actually addresses the distress of a tissue, eliciting your symptoms, you're just wasting your time. Diana, right? Those Thermacare packs are dangerous as hell. Well, I guess. I mean, I'm not familiar exactly with the packs, the patches themselves or the packs. All I know is that they've now tried to add on the electric stimulation component, which I'm describing to you now, has basically no value in terms of addressing a cause of symptoms. It's only minimizes the symptom. And the way I had learned that back in physical therapy school, those days, was the fact that once you have a certain intensity, your body will get used to that intensity. You're just going to have to continue to increase the intensity to try to get the same blocking of the symptom. Eventually, I don't think you'll get to a point where there's just not enough sensory and you'll have pain. And all you've done is delayed the inevitable. At some point, you are going to have to identify the tissue in distress and resolve it. Other than that, you're just going to keep having pain forever, indefinitely. And people find that hard to imagine, especially a muscle. People say, how could a muscle elicit pain indefinitely? Muscles elicit pain because the force requirement of your activities, you live in a gravitational environment. So you need to push up with muscles to perform any activity other than laying flat on the floor. And so if the force output of your muscles is less than the force requirement, the muscles are going to strain. Well, until you strengthen those muscles, until the force output is greater than the force requirement, they're just going to keep straining. Every time you do the activity, you're just going to strain. You're going to lose pain. That's what you always hear people talk about. Oh, my pain is brought on when I do activity. That's identifying the muscular cause. It doesn't matter what an MRI finds. I don't care what the MRI says or the X-ray says or structure. Once you tell me that your symptoms are enhanced, worsened by doing activity, you have defined the tissue in distress as muscle. So until you identify the appropriate muscle and strengthen it to the point where their force output is greater than the force requirement, you'll have pain. And you can do any of this nonsense. And all you're doing is delaying the inevitable. And boy, I would imagine it would get tiring waking up every day and having pain. So Diana wrote, if you leave them on too long, you will get real burns. That's possible. That wouldn't be shocking. I mean, any of this stuff is chemically based. So, all right, here's a neat one. This is just a simple type of brace. It's magical with the way that they cross the bands and do that kind of stuff. But again, the whole idea with things like this, with the brace concept, is the fact that the brace creates heat in the area. So it kind of relaxes the muscles. And if a muscle is strained, it's probably going to keep it warmer. And therefore, the muscle can maintain a more lengthened position. And as a result of that, it's probably not going to elicit pain. What happens when you take the brace off at night? Well, now the muscles are going to have their chance to shorten because you're not doing any activity. And if it had strained, boy, is it going to shorten. And pain receptors run along the length of a muscle. So if it gets a chance to fully shorten to where it wants to because it's strained, now you're going to have a lot of pain at night. So what's the brace doing? Nothing. Wasting time. Leander wrote, why do I have pain when I sleep on my hip, even though I'm not moving? Well, it's maybe not necessarily just your hip. It could be a muscle that's attached to your hip. You feel it's your hip, but muscles attach right into the hip joint. So like the gluteus medius muscle, I've had people where I've pressed directly on the greater trochanter, which is the outer portion of the head of the femur, and they don't have pain. And all I have to do is move slightly above that to the attachment to the gluteus medius into it, and that's where they have the pain. Here, look right here, right here. So that's the greater trochanter right here. You see this gluteus medius right here, right? Look how, if I wanted to press just above the top of that greater trochanter, I could be pressing into the gluteus medius. Now that could be eliciting your pain. You just don't realize that it's not the bone itself. The only thing that's going to make a bone elicit pain is fracturing, right? Pressing on a bone wouldn't cause bone to elicit pain. You have to have fracturing to elicit pain in a bone. So the thing that I'm assuming you're pressing on is a muscle that happens to be attached near the hip joint, and that's what you're pressing on, creating pain. I can't imagine that it's actually the hip itself, the joint. Okay? Hopefully that makes sense to you. And again, if we ever got a chance to do a evaluation, a Skype or Zoom evaluation, you could, one of the important parts of me being able to see your situation is that I'm able to see, I'm going to actually ask you, point to where your pain is. And we'd be able to differentiate where that pain is and confirm or disprove that it's the hip joint. It's very funny. I've had people, and they've been told that they're bone on bone creating a hip pain. I'll say, where's your pain? And they'll point like right here. This right here, this is the pelvic rim. That's the top of your pelvis. And yet people will describe pain here. They'll literally point right here. And yet they're being told that this structure right here is creating pain there. This structure can only create pain where? At the structure, right? That's logical, right? So you couldn't get any type of arthritic change here or a labral tear creating pain here. And yet this is where the person's pain is. It's absolutely insane. This is the danger of the medical system. They are not diagnosticians when it comes to pain. They are diagnosticians in finding variations of structures to their original shape and form. All they're trying to do is say, since I found that variation while you're having pain, I will assert it is the cause of your pain. Even as insane as this is, when the symptom you're describing could never be caused by the structural variation. For instance, this arthritic change here, creating pain here, it's just literally physically impossible. And yet, this is what happens every day. Hundreds of thousands of people with symptoms here are told they need a joint replacement. It's just stupid. It's insane. But it is that medical system. And hopefully anyone who gets to hear me says, wow, boy, a connection between the symptom and the cause. Man, that sounds so logical. Something I've never heard before. Wow, that sounds something I need to investigate. And they'll seek out the Yass method, and they'll finally have a chance to use an interpretation of the body's presentation of symptoms to identify what tissue is creating that symptom. They'll get their answer. In 98% of the cases, it's muscle. We'll do some exercise. They'll have their pain resolved, and all that hopelessness, depression, and sense of suicide goes away. It's all done. How about arthritis? Can't that cause joint pain? Oh, my God. Thank God for answering that. Leander, listen carefully. The answer is no. The answer is no. Osteoarthritis does not cause pain. Osteoarthritis is the mechanical wearing down of joint surfaces. So at the end of the two bones that make up a joint, there is hyaline cartilage, it's called. It's white, it's hard, and smooth. It is what is the shock absorbent component of the bone that takes all the forces that run through the joint. If there is a misalignment or some excess force applied on that joint, that hyaline cartilage will begin to worn down. Once it wears down, you have bone. That is the precursor to arthritic changes. You will either have wearing away of bone or you will have hypertrophic bone development. This process is so slow in its development, it takes years, if not decades, to develop. It is so slow that it never, ever elicits symptoms. Every study will show you that there are equally as many people with no pain who have arthritic changes as those people who have pain. Here's the more important point. There is no relationship that has been shown between the intensity or the severity of the arthritic change and the severity of the pain associated with it. You would say, if you're telling me you think arthritis causes pain, you would say more arthritis should equal more pain. Anybody would think that logically. Studies have shown that people with severe levels of arthritis have virtually no pain, and people with virtually no arthritis have severe pain. I have had people who have come to me and said, I had pain in my right knee. The doctor took x-rays of both knees and said, I don't know why you're having pain in your right knee, because you have more arthritis in the left knee than the right knee. What do you think that means? How do you explain that if arthritis causes pain? It's insanity. You have to believe, I know it's hard to accept this, that is a cultural statement, just like herniated discs. Forever. I see ads from the freaking Arthritis Association trying to promote this crap. I don't even, what's the money they get? Unless they get some sort of money from the government or donations or something. But why would that organization be trying to schlock or advertise about the importance of knowing when arthritis is creating your symptoms? And then the funny part is the advertisement promotes symptoms that have nothing to do with what arthritis can develop, the type of symptoms that would come. That's the sickest part of this whole thing. They're willing to just completely go away from logic and science-based evidence and just say anything, and that's what's crazy. Does that make sense to you, Leander? Hopefully it does. And you'll recognize the only time arthritis could ever create a symptom is, in fact, if the joint wears away to where there's no joint space, bone on bone. Bone on bone cannot be identified through an MRI or X-ray. It has to do with the physical presentation, which is to say that you try to move the joint, there's a major loss of range of motion, and at that endpoint, it feels like a bone's hitting another bone. Pain has nothing to do with whether arthritis is causing, because I could hit you with a baseball bat in your joint, and certainly that would cause pain, and there's no arthritis there. So to say that pain equals arthritis is foolish. There's just no connection. Typically, all that's happening is you have pain from another tissue. They found an X-ray that showed arthritis and simply tried to assert that that's the cause of the pain. Excuse me. Throat's getting a little dry. Diana wrote, the strain in my glute medius caused by sciatic nerve pain, caused by sciatic knee pain, and my bunion. Unbelievable. Right. Right. What most people aren't recognizing is that the cause of their pain is actually force-based. And this is the problem I have, is that it's so easy for them to show you a freaking picture and show you some variation. And you know, you're not educated in the medical system. So of course you have pain. There's this guy who supposedly is this authority who's supposedly looking out for your best interest. And he shows you the picture. What are you going to do? You're going to believe him, right? My whole story is the fact that the problem is you live in a gravitational environment and there's force being applied to you. And the reality is you just don't have the appropriate strength or balance of muscle to allow the forces to run through you the way that they should to allow you to do your activity without straining. That's a hell of a lot harder story to promote to somebody. But the evidence is so absolutely clear. It's just so clear that that's what's going on. The physical presentation of the symptoms tells you that. It's not just where your pain is. It's the fact that you can usually connect pain with some altered posture, with some altered movement pattern. There's the association. Oh, every time I stand or twist or climb stairs or kneel, then I reach behind me. Oh, it brings on the pain. The connection to an activity is another clear indicator. Oh, if I take a hot shower, if I get a massage or something of that nature, that makes my pain go away. So does massage make a stenosis not be stenosis, or a herniated disc not be a herniated disc, or arthritis not be arthritis? And yet your pain goes away? Clearly, what's the guy or the woman massaging? Muscle, right? So the evidence is just so overwhelming. And by the way, how about this for evidence? They spend $750 billion a year to address the country's pain. And where the hell did that get anybody? Nowhere. The same amount of people, if not more. It's never gone down. The number of people suffering from chronic pain has not gone down 1 year in the past 40 years. It just keeps getting higher and higher. And the answer is misdiagnosis, getting treatments that people never needed, leading to chronic pain. And that's what this is all about. The Yass method. The only method outside the medical establishment to address the diagnosis of your symptoms through the interpretation of the presentation of your symptoms. It's just so logical. Once anyone hears it, they usually buy into it. They hear it from a friend, or maybe they Google me or something like that, and that's it. We got them going in the right direction. They do the exercise, they end their pain, and now they're believers. And most importantly, I take another person away from the evil empire, and that is my greatest joy, to empower people to not only resolve their symptoms, but to have the understanding and to know that they can always come back to me and ask me questions and help them understand what tissue is involved. And as I said, in 98% of cases, the cause is muscular, and they can resolve that on their own, right? With all this other stuff that they're trying to promote as the cause, you are a prisoner to the medical system. You got a muscular cause, you fix that yourself. Just have to know which exercises to do and how to use progressive resistance, make your muscle stronger. Boom, you're done. Not just pain-free, but pain-free and fully functional. That's the key. All this is about how do I get back to the ability to live pain-free and fully functional. I want to do the things I want to do in my life, and I don't want anything to stop me. That's the life you want to lead, right? That's the life I want to give you. All right, this guy, look at this guy. This guy looks very serious. He's looking very medical. Look at that. This is the new traction machine. And all you do is you lay on that. And that's going to somehow bring you freedom of pain from the back. Look at that nice red spot in the lumbar spine. Ooh, this is the answer right there. All right. So you live in a gravitational environment. You sit all day, you stand, you do all that stuff. But you're going to lay on this for 10 minutes and everything's going to be good. Oh, yeah, until you try to stand or sit or live your life, right? It's just insanity. Insanity. What do we got here? Another sleeve. Love the knee. They love the knee sleeves. Everybody loves to give you the knee sleeves. Oh, the best. Well, what do you know? Another knee sleeve. Another knee sleeve. You can tell that the knee sleeve one has been around for the longest. I think they've been schlocking that. Certainly one of the longest things that have been around. This became easily, I think, the hottest one. So people have been always pushing the things to fix your knee and your back. But boy, now, because of the use of the cell phone and the computer, the forward head posture thing, this is the hot button thing now. All this nonsense to bring your shoulders back. So can you see, like, you have this main frame here, and then you get this strap, and it pulls your shoulders and pulls them back. And you're going to have fantastic posture now. So again, I ask you the question. This thing is going to suck your shoulders back. The rhomboids, mid-traps, and lower trap muscles right here that are responsible for doing that are no longer going to have to work. What do you think this is going to do, wearing this to those muscles? Going to make them stronger or weaker? They're going to weaken to the point where the moment you take this off, your head is probably going to be sitting on your chest. Because I don't think, again, you're going to wear this 24/7, right? I don't think you're wearing that to sleep. You're not going to wear that in the shower. Right? Not when you're in bed with your husband or wife or boyfriend or girlfriend. Can you imagine you take this sucker off one day and you can't pick your head up? Can you imagine that? What's ramification? What's the liability to this schmuck who made this thing, right? I assure you, this guy is protected. I can assure you, this guy was prepared for any lawsuit that was coming. In the meantime, you can't hold your head up. Cookie, man. Of course, now you got your massagers, all different types of massagers. And I'm not saying, hey, man, I'm not going to say, if you want to do this to me, God bless, I'd be happy for it. You can give me that massage. But is that going to resolve the trigger points that are developing in my muscles? It doesn't resolve anything. It will relax the muscle until the muscle is required to be used for a functional activity, at which time, if the force output of the muscle is not greater than the force requirement of the activity, my muscles will strain again. I'll get the nodding again, and you probably have to do that every day to me for the rest of my life. And I mean, no wrong. If you want to get that done, God bless. But if you don't want to be dependent on that, you want to have a life where you're still pain-free and fully functional, you're going to have to address the muscle deficits that you have, the weaknesses or imbalances. And the only way to do that is through progressive resistance. You got no choice. You're going to have to lift weights, either weights, using resistance bands, machines. I don't care the mechanism. But what you better understand is that doing an exercise is not the answer. Everyone thinks, oh, I do the exercise. That's the answer. And you find out they're using no resistance or minimal resistance. They can do 30 reps. Progressive resistance is an attempt to cause a muscle to adapt to greater and greater resistances, thereby making the muscle strong enough and growing muscle mass to where it has a greater force output than the force requirement of your activities, right? That's the way this is supposed to work. So if you're using very minimal resistances, how's the muscle going to adapt and get stronger? A year from now, you'll tell me how wonderful you are, how you've been consistent doing your exercise. Then I say, how many times have you progressed the resistance? And you say, progress what? You're still a year later just as strong as you were day one. You haven't done anything. It is not the exercise. The exercise is a mechanism. It's a mechanism that allows you to isolate a muscle so you can apply progressive resistance, increasing resistances, which allows the muscle to respond by making more muscle mass and developing a greater force output. Once the force output is greater than the force requirement of the activity, voila, pain-free, fully functional. Diana, tell us about the relationship between the hamstrings and the quads and low back pain. Okay, so in terms of that lower back pain, the idea there for 90% of the population is the fact that the front thigh muscles, known as the quadriceps, are typically much stronger than the posterior thigh muscles, the hamstrings. The quadriceps muscles are attached to the pelvis at the front, and the hamstrings are attached to the pelvis at the back. So oftentimes people have heard that the answer to maintaining this neutral posture, not that excessive arching, not that hunching, but that nice mild arch in the back, that the answer to achieving that is somehow strengthening the lower back muscles and the abdominal muscles, core training. And it turns out that's pure bullshit. It was never going to work. The abdominal sheath can barely hold in your abdominal viscera. So the idea of it having any control over stability of the back is somewhat ridiculous. It was just some scam, another ridiculous promotion. The way to achieve that proper arch, because the spine is sitting on the pelvis, is to control the pelvis from below that. And the way you control the pelvis below that is to maintain balance of the quadriceps and the hamstrings. If the quadriceps are stronger and they shorten, they're going to pull the front of the pelvis down, and you're going to see that pelvis pointing down in the front, which creates an excessive arching. The low back muscles, which are attached from the bottom of the rib cage to the top of the pelvis, will shorten and strain. So lower back pain, which is muscular based, in most cases is due to stronger quadricep muscles, front thigh muscles, than posterior thigh hamstring muscles. And the answer to resolving your lower back pain is not to address the lower back. That's where the symptom is being experienced. But the cause occurs below the pelvis. It is to stretch the quads and strengthen the hamstrings. Once you have balance, the forces on the front and the back of the pelvis will be maintained neutral. And you will have this very subtle arch in the lower back, which allows the low back muscles to maintain their optimal length, optimal distance, and therefore remains able to create their optimal force in supporting your lower back and prevents you from having lower back pain. Okay? So if we're having lower back pain, just because the pain is there does not mean that's where the cause is. In 99% of the cases I've ever treated, the cause of your symptoms is someplace outside of where your symptom is being experienced. Very important to understand that. That's a good question, Diana. All right. So just so you can see, they've tried to take it up a notch And here's another one of those wacky braces, but here they've just stuck an electric stimulation machine on there. So not only is it going to replace my muscles in pulling my shoulders back, now it's going to try to stimulate and to send some sensory aspect into there. More waste of time. I thought this was interesting. Who hasn't heard about diabetic neuropathy? Diabetic neuropathy. What's going to make a diabetic neuropathy go away? An ankle sleeve. The funniest part about how stupid this is if in fact you really did have diabetic neuropathy, that's a systemic disease. What that's saying is that you have diabetes. Diabetes, so I don't know if anyone really understands this. What diabetes relates to is the fact that either you have in type 1 diabetes the inability to produce insulin, or type 2 diabetes, a lack of sensitivity of your cells to insulin. Now, glucose, which is the energy source for all your cells, has to enter your cells on the back of an insulin molecule. They got to go in together. Without insulin, glucose can't enter the cell. So in the case of type 1 diabetes, you just don't produce insulin. So that's why the person needs insulin injections. Type 2, you have a sensitivity to it. And they're going to still try to tell you need certain medications, all this other nonsense. But the whole idea of what diabetic neuropathy is implying is that somehow the nerves are not getting the glucose nutrient and the nerves begin to die. And in this case, they're saying that it's causing the nerves to the foot to die. So I'm trying to understand, if you have this metabolic systemic disease, how is wearing that sleeve going to make that any better? That's just really wacky. I don't get that. One's way, way out there, way far out there. For everyone who really wants to understand this diabetic neuropathy thing. So you have alteration in your foot. You go to somebody, they tell you have diabetic neuropathy. I want you to think of this logic. They're telling you that the nerves in the foot are not getting the glucose in, which is causing them to die, creating this sensory aspect. I would like you to look at the skin of your foot. Look at your nail beds and tell me, what is the health of your skin and your nail beds? If you say that your skin and your nail beds look fabulous, then I need someone to explain to me how the systemic diabetes has chosen to only affect the nerves in the foot, and yet the skin, the bones, the nail beds are all perfect. But somehow, magically, the diabetes only affected the nerves. Hopefully, everyone would say that's insane. Now, if you really want to know what true diabetic neuropathy looks like in a foot, person probably has gangrene, and they've started losing toes. I've treated enough people who had legitimate diabetic neuropathy, who have had amputations. That's what diabetic neuropathy is. This bullshit that you have an alteration in your toes or your foot, and that's being caused by diabetic neuropathy, is pure crap. Don't tell me that a systemic disease gets to pick and choose which systems it gets to work on or affect, while the others are completely ignored. It doesn't work like that. Diabetes will affect every tissue in that area. What's most likely creating your altered sensation is something like sciatica, where the muscle in the butt called the piriformis is impinging on the sciatic nerve. There's a nerve called the peroneal or tibial nerves, which can affect the foot. They could be impinged on the side of the shin. Then, of course, if you're having altered sensation under your foot, if you flattened your arch, you have a portion of the arch that should never touch the floor, and that's being compressed. That can create altered sensation. There's lots of answers as to why you'd have altered sensation in your foot, which are logical, versus diabetic neuropathy. But if you're a doctor and you sell whatever drug they want to sell for diabetic neuropathy, then they're going to be really happy to promote that to you. It's just pure crap. Logic will tell you that unless you're seeing your skin deteriorating, your bones deteriorating, your nails falling off, then don't tell me that just pure altered sensation in your foot is coming from diabetic neuropathy. That is pure crap. Diana wrote, so if you are a runner or hiker, you probably have strong quads and weak hamstrings. Correct. Absolutely. So just by nature, if you were to look at every single person in the world, everybody's quads are slightly bigger than the hamstrings for the very reason we do everything in front of us, right? We walk forward, we get up and down forward, we go upstairs forward, we climb, whatever. So everybody has the imbalance. The question is to what extent you get the imbalance. If the imbalance gets so great that, let's say, for instance, the quad pulls too hard on the kneecap, well, you'll end up with knee pain from the imbalance. If the quad pulls down too hard on the pelvis, you'll get lower back pain. So it's all a question of the extent that the imbalance occurs. And the great part is that regardless of the activity you do, as long as you're doing the appropriate exercise, progressive resistance exercise, and sustaining the balance, regardless of what you do, you'll always be able to maintain balance of the muscles, and you won't have pain. That's the point you want to understand with the Yass method and Yassircise. Yassircise has to be the core of any exercise. I don't care if you want to run, swim, do aerobics, yoga, Pilates, CrossFit, Orange Theory, whatever you want to do. Doing that does not make you strong and balanced. Doing that requires groups of muscles because they're activities. And therefore, if there's a weakened muscle or imbalanced muscle, it will sustain and worsen through doing that activity. You need to do isolated strengthening to make sure you have strength and balance of all your muscles. That's what allows you to do all these activities without symptom and optimally. So Yassircise should be at the core of any type of activity-based exercise or any activity as a whole, okay? We need to be making sure all our muscles are strong and balanced before we do activity and assuming that doing the activity won't lead to some sort of symptom. Here's another one of the types of braces. You see how many there are? Isn't this incredible? All this nonsense, everything I'm showing you, worthless crap. Another massager. Look, he's sexy, isn't he? Look at that. That's a great picture, isn't it? Nice way to sell a massage thing. Another brace. This is kooky, man. This one really, I thought this one's actually pretty impressive. Here's an actual cervical traction unit for home. I don't know if I'd want to be applying pressure to my neck without anybody being there to determine whether what the hell I'm doing is valid or not. But here's a cervical traction unit for home. Everybody has to get into this, into the pain game. You know, Vera sign, what's it called? Vera sign, the desks that go up and down, right? So here's the answer. Oh, I have low back pain when I sit at my desk. Vera desk, I guess is what it's called. Oh, I have pain. Oh, so I'm going to stand. As if standing doesn't have its own group of muscles that are going to strain and elicit pain and create a whole nother set of issues. So the answer is do one activity that causes pain, stop that, so you do another activity that causes pain, right? So here's some company that said, you know what? Let's just lift up the angle of your laptop, your laptop, and that way, ooh, look at me. I won't have neck pain, right? Everything is an appliance, an accessory. There's always some crappy thing that they want to promote to you other than addressing the cause. Establish cause, address cause. I'll eventually have another logo. That's my other big thing that I try to get across to people, right? Establish cause, resolve cause. Without that, you're blowing smoke up your butt. Another brace. I thought this was interesting. They're promoting this as some sort of traction unit. See the lady? Like she pulls up on that thing, it's flat, and then it causes her to force her to arch her back. Some funky traction thing. This is kind of, what's that idiot now? The copper, something copper, Tommy Copper. Has every type of thing you could apply to supposedly support yourself. And they get NFL players to promote that stuff. He's got the socks, the compressive socks. Yeah, he's kid. This is like one of those. That's a brace, some whacked out brace. Mm-hmm. And then finally, the worst of all is this group, and I'd love to see them go out of business. This is the Bonatti Institute, and they're telling you they have surgery for what? Sciatic treatment. right? Where does the sciatic nerve begin? It begins in the butt and ends at the back of the knee. There is absolutely no connection of the sciatic nerve to the spine. So anything they're going to try to do with the spine could never, ever, ever address sciatica. And yet these pieces of crap are out there. This group has more advertisements out in every type of social media setting that I've seen. It's shocking to me. It's a medical organization, and they are spending, I would only imagine, millions of dollars to promote themselves. Well, what does that tell you about the quality of care that you're getting? I had a practice, and I had at one point a 6-month waiting list to see me. I had people coming in from other countries. I never invested a dime in advertising or marketing. It was almost 100% word of mouth. When you're good, people find out about you. The problem with these guys, the Bonati Institute, is that everybody has heard such horror stories about surgery for the back that nobody wants to do it. So they got to advertise. And people come on. The reason I wanted to show this is that I see these advertisements, and there are people, and it says 200 comments and 10,000 people looked at this. And I'm thinking to myself, you poor bastards. I dig you're in pain. I understand it. You got to try to be smart about what you're looking at and stick to the core principle. You got to get the right diagnosis before you can get the right treatment. If you don't know what you're treating, how the hell are you going to get a treatment? And just because these people show pretty people and amazing results and all this other crap, trust me, there is going to be somewhere in that documentation that magical line, results will vary. Every time you see any advertisement and you see the phrase results will vary, just think about what that means. What they're saying is don't expect this from them. If this person says I'm floating on cloud 9, I'm in heaven, don't expect that, because results will vary. That's what that means. So I assure you, in every one of these, there's some sort of disclaimer somewhere in there telling you, doesn't matter what any one of these people are saying, don't expect the same result. Leander wrote, so yoga is good for stretching part, but you need progressive resistant weights for strengthening the opposite muscles. So when you talk about the stretching part of it, some of the stretching is an appropriate stretch. Some yoga moves are stretches. But like if you were to do the tree, right? The tree incorporates a group of muscles trying to perform that movement, and it's an isometric movement because you're not going through range of motion. So if you're doing the tree and a couple of your glute max maybe isn't strong enough, or your glute med isn't strong enough, you're going to strain in doing that exercise because you didn't do the isolated strengthening to allow you to perform that activity. What's that? Downward dog thing is another one. A multitude of yoga moves are incorporating groups of muscles to perform them. And let's be clear. I'm not saying don't do this stuff. I think you should do. My promotion is you want to climb Mount Everest? Let's do that. Let's enjoy life. But let's make sure we do it safe by making sure that all the muscles required to perform those activities are strong and balanced to allow you to do the activity fully without the chance of injury. And that's my point to everybody. Everyone thinks back surgery is the answer. It's not. They tell you up front surgery could make your pain. Yeah, at this point, most people that come in contact with me now will tell me that if they've gone to the doctor, no one's giving that song and dance they used to. Oh, you'll be dancing in 2 days. Everybody says the same thing. You got a 30% chance of getting better, 30% chance of getting worse, 30% chance of nothing happening. It's staying the same. Those are odds. That's just the odds. So what does that tell you about this? I try to explain to people about this. There are 2 types of information you can have. You can have model-based, and then you could have data-based. Usually people who promote model-based information don't like the data. Data is real. Model's theoretical. Data is real. Data is what's happened. So when that person tells you got 30% chance, what they're really saying is that if we really discuss the data says you have a 70% chance of failure. So much so, we created the diagnosis failed back surgery syndrome, right? Is that the data you want to hear? No. So I give you some model concepts, theoretical, right? You want to know what's real? You look at data. Data tells the tale, right? And 40 years of surgeries, there's so much data, it's coming out your nose, man. Are you kidding me? And what does the data say? The failure rate for back surgery is 70 to 80%. Like I said, they created the diagnosis, failed back surgery syndrome. People talk about hip and knee replacements. Oh, there's a wonderful. Do you know the number of revisions being performed? That's the surgery, and the second and the third and fourth and fifth surgery being performed after you got the first surgery, and the first surgery didn't work. I would imagine at this point, there probably are more revisions being performed than surgeries. What does that say about the validity of the original surgery? It's got to be freaking insane. Right? But they'll still give you the song and dance. Oh, it's bone on bone, right? Because they got to keep promoting it. The funny part is you had pain, you get the first surgery, and you still have the same pain as you had before. And they'll tell you, oh, the problem is that the prosthetic came loose or it's not fitting right or it broke or something like that to try to get you to get the revision. But you got to try to use a little logic. If you have the same symptom after the surgery as before the surgery, that tells you that the surgery had nothing to do with the original cause of the symptom. So why would getting a revision help the situation? You had to have realized that since the first surgery didn't work and you had the same symptom, it clearly didn't address the tissue in distress eliciting the symptom. So I don't give a shit. You can get 10. Get 10 revisions for all I care. You'll be right back where you were. Nothing's going to have changed. And yet, you get sucked in, man. I dig it. I understand it. I understand why people get sucked in. And my answer is, I'm your alternative. Don't want it to be this way. Would love there to be more people that are out there. I mean, to me, one of the greatest honors is in a couple of weeks, I will be providing a presentation of my method to the India Rheumatology Association. What an honor. What an honor. For the first time, a medical body is interested in seeing how the Yass method works in diagnosing and treating pain. This is an honor that's above anything I've ever gotten. And I hope that they will embrace it and begin to use it. And we can now try to expand awareness of the Yass method beyond me, which is all I've ever wanted. I don't want to be outside the medical system. If the entire world's medical system embraced the Yass method and began to use that as the primary method of diagnosing and treating pain, I'm in. But if you're going to reject it for the MRI and the X-ray as the primary diagnosis, well, I can't have any part of that because that's worthless. Any junior logician would know that that's just using the most basic form of logic, correlative theory. It's just foolish nonsense. So I hope that things go well and that, who knows, maybe I'll spend some time in India, open a couple of facilities and get a bunch of people to follow my method and we'll go from there. But in the meantime, as usual, I've talked for quite a while. It's already an hour. So let me just try to summarize. The whole purpose of this episode today was just to show you that there's so much crap, so many charlatans out there just trying to manipulate you into thinking that they got the answer to your pain. And the only reason you got here was because the primary medical system's method of diagnosing and treating through MRIs and X-rays is failing you. And so you're stuck with pain. You're becoming hopeless, depressed, some people suicidal, and you're looking for an out. And these charlatans are all out there trying to take your money out of your pocket. What's the purpose here is just to make you aware that unless you get the right diagnosis through an interpretation of the body's presentation of symptoms, you're going to be misdiagnosed. You're going to have chronic pain. And that's what the Yass method's here for. So if you want to get in touch with me, I'll type it one more time. Email. This is my email. You can take it down. Dr. Mitch at mitchellyass.com. If you want to get in touch with me, if you have a question about your particular situation, you're not sure what direction to go, if you've decided that the Yass method is your answer. I know the coronavirus thing is freaking everybody out. No one wants to do anything in person. Well, for the last, 5 to 10 years, I've been doing Skype sessions. Now we're doing Zoom sessions. You can do these sessions in the safety of your home. It's still incredibly effective in diagnosing the cause of your pain. In 98% of the cases, it's muscle. And so if so, I will demonstrate the exercise you need to perform. You will perform the exercises under my supervision. As long as you have a resistance band, I'll show you how to use that resistance band, a door and a frame, a door and a chair. Resistance band, door, chair. That's all you need, and I can strengthen any muscle in your body. And you can certainly do that at home. The great part about these situations, these sessions, are that they're videotaped. You download it onto your hard drive. You have it for the rest of your life for reference. So if someone's considering this, you say to yourself, well, I think I need lots of sessions. I've gone for physical therapy for 2 years or 3 years, right? You have to understand that if, in fact, the cause of your pain is muscle, the first thing you got to do is figure out that it is muscle. Once you figure out it's muscle, you got to know which muscles. Once you know which muscles, you got to know how to do the exercises and how to use progressive resistance. Once we get beyond there, you don't need anybody else. You just got to do it. Do the exercises, increase the resistance, get the force output to above the force requirement, and you're there, pain-free and fully functional. So you really don't need more than 1 or 2 sessions to achieve this. And you start with one and you play it by ear. In a month, 2 months, if you need another one, you get another one. But the power is certainly within you to resolve muscular deficit. So that's the story about that. If you want more information, you can also get it through my books, Overpower Pain, The Pain Cure RX, and the Yass Method for Pain-Free Movement. If you want to see just more general information, you go to my website, mitchellyass.com, mitchellyass.com, right? You can go to my Facebook page, which is at the Yass Method or Dr. Mitchell Yass. Plenty of information, lots of videos there. And of course, on YouTube. I think this is about my 66th to 67th video. And if you like this stuff, if you're really thinking on producing something that's helping people, please subscribe to the channel and like the videos. This helps me expand awareness. YouTube pushes me more out in their search, and so does Facebook. When I'm getting a bigger audience, it shows credibility. So anyone who sees this stuff, please tell your friends, family, co-workers. This is the place where you're going to find the answer to resolve your pain and get your lives back. You've tried everything else in the medical field. Now it's time to go out. They talk about advancements in humankind always coming from somebody who sits outside the existing system and finds something that nobody else has. Trust me, that's what this is in terms of diagnosing and treating pain. So let's all work together. The famous line with the coronavirus. Well, let's join with that mindset in terms of resolving pain. Let's all work together. Let's make people aware of this. Let's end a system that is fee for service, which means that regardless of your outcome, these people are getting paid. There's no incentive to ever get better. Don't forget that. Don't forget that. As long as they get paid, whether you get better or not, they really don't want you to get better because it keeps you around longer and longer. Diana wrote, everybody thinks back surgery is the answer. It's not. Oh, did we do that one already? I think we did that one. Oh, Leander wrote, thank you. You're welcome. Thank you for joining me again. Thank you for everybody. Let's spread the gospel and keep the Yass method growing. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.